Today's podcast, we're going to be talking all about how you can decompress your spine safely at home. We're talking specifically about decompression stretches today. We've got quite a few things on the board to cover, so hopefully you're going to find this one really, really helpful. As always, if you've got any questions on these podcasts, please do post them in the comments. We read and reply to all of those, and it just helps us guide the support to your specific needs. So before we get into it, just an overview of what we're going to talk about today, because it's really going to be in two different parts. We've got the first part, which, forgive me, is kind of a background in decompression, etc., to help you avoid the mistakes, the most common mistakes that we see time and time again, which really stop people from being able to recover from lower back pain, because they're fundamentally kind of working against these principles that we'll talk about here. And then the second part is going to be some practical bits and pieces. We're going to reference some other videos as well, which will have links in the description, so you can check those out if they're of interest or appropriate to you. So let's start things out to begin with by talking about why we would bother decompressing at all. And the fundamental need for this is that most of us are spending, on average, as we've quoted many times before, 9.5 hours a day sitting. We sit at the office, we sit on our way to the office, when we're at home, etc. And all of this is adding load, squashing down on our lumbar spine. But it's a little bit more than that. Not only is sitting putting a bit more pressure on these discs, it really focuses pressure to a specific region of the lower back, the L5, L4, and L5S1 regions, which are right down here at the very bottom part of the spine, the areas that are most commonly at the source of many of you watching this and your lower back pain. But also, in addition to this, the sitting position for so many hours every day is also flattening out and eliminating the lordosis. And we'll see why this is relevant a little bit later on as we cover some of the bits and pieces on the board. But on top of this, over the years, as we are going through life, we get into the workplace, we're working through our career, etc., we also have this addition of increased load, increased compression through the lumbar spine day in, day out in a repetitive strain sort of way. But we also have the decreasing competence of our body. We have the decreasing strength, the decreasing resilience. And at some point, these two meet one another and we start to get problems. We start to get that stiffness, etc., that develops. And often it's that muscle stiffness, that aching in the lower back, which is the very first sign. And if you ask people around you in the office, you say, hey, have you got back pain, etc. Many of them will say no, not really. But then you say, have you got any stiffness in the back? And say, oh yeah, I've had that for years. I've had that since I started working, since I started university, since I even was at school in some cases. Because this constant sitting, squashing down on our lower back is just not ideal. We need to move a little bit more. We need to change position a little bit more. And the way in which we're geared up for work life, even at school, sitting for extended periods, working on assignments for extended periods, we're just sitting. And there's not necessarily that conversation about actually doing things in a bit more of a varied position, going from sitting, using a sit-stand desk, etc., things that we've covered at length on other episodes of the podcast, specifically linking the episode we did on setting up your workstation in a bit more of a back-friendly way. But this is where the root of these issues arise and why we want to consider an alternative or a remedy for that compression that is in every aspect of our life on a daily basis. Fundamentally, we live in a world with gravity, and many of us will also incorporate exercises, hopefully going forwards from this point, that are going to add load. And we want some way of dusting off the cobwebs, some way of providing an opposing force in our daily lives. And that's fundamentally why we're going to be doing the decompression. Now, there's a couple of things we want to think about here. And that's first and foremost that we want to decrease tension on the muscles. So we think of decompression, and we'll get to it on the mistakes here in a moment. But firstly, we're trying to decrease the tension on the muscles, because when we're sat in that position, we're squashing down on our discs, yes, but we're also stretching the muscles out. But there's two different ways the muscles can be tight, and these are often really misunderstood. And that leads us to making the mistakes we'll talk about in a moment. And that is, muscles can cramp up, they tighten, they shorten, like when you've got a calf cramp. Your toes point, the muscle is objectively shortened up, and there's tension there. It's very acute. This might be also similar to the case of antalgic posture, where you're stuck leaning off to the one side or stuck bending in one direction or the other, because there is this cramp-like antalgic posture, pulling of the muscles and shortening of the muscles. But for a lot of people, they say there's tension, there's spasm, etc., but they're not exhibiting a short-term cramping sensation or shortening of the muscles. There is just tension there that is quite intense, so to speak. And that is more often the case caused by the pulling apart of the muscles and the tension in response to that pulling apart. Sitting rounded over the desk for extended periods of time. And as we do that, we flatten out the lumbar lordosis, we pull the musculature apart and create a tension through those muscles that can feel quite intense at times and can feel quite spastic in terms of its nature. It's there, it's sharp, it's pulling, and it's really focused in that lower back. But it's very different to that cramping that we used, where we used the calf as an example, the calf cramping, where the muscle is objectively shortened. And we must start to get a better understanding of the type of tension that's occurring in our lower back and start to appreciate that if we're going to do some decompression stretching for our lower back, we want to make sure that it is not working against some of the principles that we need to adhere to if we're to effectively decompress our back. And we're actually considering the sort of tension that is there in the lower back by evaluating how it got to be there in the first place. So if you're spending 9.5 hours a day sat down with a rounded lower back, maybe not significantly rounded, but just flattened out, then we are stretching the muscle apart. We are not contracting it away. We're not stuck in this sort of position here, which is sometimes the case. But we're actually just tense all the time, and maybe it's pulling us a little bit off, but more of that is us leaning away from the side of pain than the actual contracture itself. And we do see some people, they're really stuck, translated off to the one side. The spine is really pulled out of sorts, and they're stuck like that. And that's a little bit different. But even so, this decompression is going to help. And then we get to the compression on the spine. We want to decrease the actual compression that is going through our lumbar spine, particularly if we've been diagnosed with things like disc herniations, degenerative disc disease, and as a result, we've got a degree of stenosis. Remember, when we squash down on these discs, the holes where the nerves come out at the side of the spine, those holes get smaller, which means we have less capacity to deal with excess inflammation in that region, and we're more likely to suffer with pain associated with the inflammation, not necessarily the tissue damage, but the buildup of inflammation in a confined space. What does good decompression do? It opens out that space, creates a little bit more space, and takes pressure off the discs. And this leads perfectly into why so many people get caught out making this common decompression mistake in the lower back. And they're focused primarily on that space and on the tension in the lower back. They're working from a muscle first point of view. They're looking to just stretch the lower back musculature. And fundamentally, they're making the underlying cause worse. Why? Because they're stretching that musculature through the lower back, so doing more of this, even more, even though those muscles were already pulled apart, in an effort to actually decompress the space on the back of the spine where the inflammation is built up. But in the process of doing that, they're squashing down more on the discs. They're aggravating tissues that are trying to heal up and restore stability. And find, from experience, that you do these stretches, they feel nice, but you find you need to do them more and more and more. They're not progressive. You're not going anywhere. We're just spinning our wheels on the spot, not actually providing any healing help. Because as we go to decompress one small area of the spine, we are forsaking the rest of the spine and providing compression in those areas. And we're also adding tension, maybe not quite the decompression being the right word, but we're adding tension to the musculature as we pull it even further apart. And the reason we've covered this part first in the decompression is because too many people in their frustrations with not getting results with their back try and add more and more stuff together. They try and put together their own program. They try and put together their own exercises and stretches. But if we have little bits in there that are undermining the healing process, even if we're doing some of the right things, having these wrong things as a feature of daily life will undermine that healing process and prevent you from benefiting fully. If you're running 2 steps forwards, but you're always going 2 steps backwards, you're not going to get the results you want. So in order to get results, we must first stop doing these sorts of things. And that is classically the knee hugs. It's the child's pose. How long do you have to do these things for before we realize they're actually not taking us anywhere? What is the progressive route? Where is the end game? What's the target? And if we contrast this very, very briefly, so we don't go too far off topic, with strength-based exercises, there are clear markers and measures of improvement. How do you know you're doing better at a knee hug or a child's pose? There is no progression. It's a movement. It's a practice. It's not actually progressive in any way. So we have to have that as part and parcel of our rehabilitative approach. And as we've argued in many of the other videos, doing these sorts of exercises is actually undermining the healing process for some of the reasons that we've mentioned here and many more besides this. So now, if we get on to the more productive part of today's episode, and do bear in mind, we'll link to a few bits and pieces as we go along here that are hopefully going to really help you guys get even more. As with these podcasts, there's a bit more of a conversation. We have other videos that we've shot as part of this podcast that will really help you get some visual demos on these things. So the first and most important thing we want to check when we are doing a decompression stretch for our lower back is that they observe these checks. So number 1, we want to observe the lordosis. Is the stretch you're doing the stretch and putting your spine in a position where we have a lordosis. A lordosis is not a backward bend. A backward bend is more of a lordosis. The lordosis, the spine should have a lordosis to it. It's not a case of being straight and then forward bending and backward bending. It should have a backward bending curve going through it. And therefore, that is the lordosis position. All of these stretches should be done in a lordotic position with a neutral spine. Now, you might ask yourself, well, how do I know if I'm in that position? Just do a simple wall drill, which is where you stand with your heels, bum, middle back, and then your head against the wall. That will roughly align you vertically. Now, if we want to start getting into the nitty gritty, so to speak, with regards to the alignment of the lumbar spine, we can only effectively evaluate it on a standing load-bearing x-rays. Postural examinations are absolutely terrible. And the reason I know that is having done thousands of them and comparing them in all those thousands to the x-ray images, you realize how little you can know on a physical examination. We've done dedicated episodes on imaging and the utility of spinal imaging before, and the lack of utility in making those sorts of observations of spinal alignment that physical exams have within those episodes. So I won't go into too much detail now, but the best thing we can do is stand in the best position that we can stand in, which is vertically aligned, and using a wall to help that is going to be helpful. Now, if you've been doing knee hugs and child's poses for many months and not been getting anywhere, and you've got into a bunch of bad habits, which means you're leaning forwards more than you should be, rounding the lower back more than you should be, and creating those sorts of issues, then you might actually find it very difficult to just stand up straight. And in that case, definitely check out some of the videos that we've done on contrast bathing and contrast therapy, because that's going to help you just calm things down a little bit faster and reduce the inflammation in that area, because most of the time it's that there's this excess inflammation in that region, which means that you're stuck like this. And if we just use this upper lumbar segment so you can see it a bit more clearly, but the same applies to the lower back. If we're stuck like this, you can see the hole is larger at the back of the spine where this little yellow nerve is coming out. And that means that is filled up with inflammation, let's say. And as you go to even stand close to straight, the hole gets smaller and therefore compresses the excess amount of inflammation that's built up in there by virtue of the fact that you've been leaving the hole larger than it should be so that it can build up. So we need a way of trying to get the inflammation down in that region so we can actually get ourselves back to upright again. And that's, maybe requires a little bit more information. And you can always post in the comments, as I mentioned earlier on, if you think that applies to you, you're struggling to actually stand up straight. But that's very, very common for those with more severe, long-standing lower back pain who've been caught out doing these sorts of stretches for a long period of time. You just end up bending yourself over more and more and more, and it's just not going anywhere in the right direction. So we have to observe a lordosis first and foremost when we're doing any decompression stretches to the back. Second point, apply the decompression to that neutral spine, which means that we are in this position and then we are applying the decompression that way. We're opening out, we're creating a stretch through the lumbar spine, observing the lordosis, but applying it to a neutral spine. We're not moving the spine into a different position. The big flaw with something like a child's pose or a knee hug is that you are applying a decompression to a specific part of the back where inflammation is built up, but you are not applying it to a neutral spine. So we are compressing certain structures as we stretch others. We're creating a pivot, a seesaw, if we will. One side goes down as the other opens out, and that's not helpful. So again, you can see how if we apply these checks to some other stretches, which are called back decompression stretches, we can realize that they actually don't fit the criteria. And then finally, where possible, and for some of the exercises which we'll touch on here, this isn't possible, but for others it is, we want to create a bit of pumping. That pumping is that small movement which also again helps in aid reduction of the inflammation. It also helps in aid providing nutrients and tissue fluid exchange in and out of the discs in the lumbar spine where we're targeting. And that is a great way of emulating some of the more targeted treatment therapies that we can do in more of a clinical setting. So once we've got those checks and balances there, we can then start looking at some of the actual stretches to decompress your spine that actually do fit the bill. And these first three are all free. And I will say that you can always check out the video we did on these three stretches earlier this week. There'll be a link in the description, so you can always check that out, where we demonstrate how to do them, etc., in a step-by-step way. But the first and most important one is going to be the towel. That's a core concept of the Back in Shape program. Why the towel? What is the towel doing? The towel is supporting the natural lordosis. Check. It's creating a little bit of decompression with the weight of the pelvis, and therefore it's applying the decompression to the neutral spine. The only downside of this one is we can't quite pump it, but it's better than nothing. It's a great way of safely and gently getting onto that position. And if you check out that video, this one in here, we talk about a little mobilization you can do for the towel, which will add a little bit of pumping. So if you're interested in that, check that one out. The second one is the bed decompression. This is an absolutely fantastic one where we can, again, use a bit of pumping here. But first and foremost, we're on our tummy across the bed, which means we're allowing a lordotic position to set in place. That's the first thing. We haven't got any pillows propping us up or anything like that. We're just in that neutral position here. So we've observed the lordosis. We're then using the quirks of the positioning of the exercise to apply the decompression to the neutral spine. And because of that position with the arms, as we discussed in the video, we can use the bed decompression to gently create a little bit of pumping in the lower back. And then the final one is going to be the chair decompression, which we discussed. And that one, we're in a slightly different position. We're using the quirks of the chair to support the neutral spine or support and observe the lordosis. And then we're using our body weight to apply the decompression stretch to the neutral spine, dropping the pelvis a little bit and gently unloading, particularly the L5S1 and to a lesser degree the L45 from the bottom this time, as opposed to pulling from the top, like is in the case of the bed decompression. And all of those are basically checking all these boxes with the slight quirk of the towel, but they're all free to do. How often should you do these sorts of decompression stretches? Well, think about it like brushing your teeth. You use your teeth a couple of times a day, eating, etc. We use your back every day, maybe for 9.5 hours. Maybe you're doing a bunch of other stuff that's not necessarily ideal. So we can do this every single day, and we do it as a relief-based exercise, relieving the strain of gravity of life on your back. We do it for around about 3 to 5 minutes at a time, holding a stretch, maybe pumping, as the case may be. And we can do it 2 or 3 times daily. If you are in the throes of a flare-up, you're getting some severe back pain, then you can always do it a little bit more frequently, but always more frequently rather than longer durations. Always works best, especially with these. And you can always combine these together to get a kind of a blend, if you will. The towel's a little bit more relaxing. The bed decompression works a little bit better. The chair decompression is a little bit stronger. My personal favorite two would be these two here. I find the chair sometimes a little bit cumbersome, but other people really like it. So test these out and give them a go. But 2 or 3 times a day is perfect. 3 to 5 minutes, it's not a lot, but it really, really can help you provide that decompression to the lumbar spine. And then, as I mentioned, these are free. We've got other versions that many people have at home. I was only speaking to someone just today, talking about their physio and a friend both had some of these inversion tables that they could try. If you find it helps you, it's a really good tool to provide a decompression, because on the inversion table, as we demonstrated in the recent video, again, link in the description, you can observe the lordosis, especially if you're using the good teeter tables, which are the ones we recommend. They've got a nice arch support in the lower back, which is great. We can apply the decompression stretch gently to the neutral spine, and we can create a pumping by adjusting the amount of inversion that we actually put on the table, how much pull of our body weight is being applied to the lumbar spine, and we're in 100% control of that. It might take a little bit of practice, but that's available to us around about 300 to 500 pounds. Do not get cheap inversion tables. You don't want to skirt on the expense when we're dealing with something that's turning you upside down and holding you there. So that's a word of warning there. And again, if you're interested, check out that full video. Now, I should definitely cover a couple of things about surgical decompression, because this is important. And we have to think there is an area that is being decompressed when we're talking about surgical decompression. And in most cases, it's very similar actually to the stretches that we do when we talk about knee hugs and child's pose, etc. And it's decompressing this space here. Or it's decompressing the pressure of a disc pressing on a nerve. It's not actually decompressing the spine, generally speaking. Now, there are some vertebral disc replacement surgeries which will actually kind of prop up the spine more than decompress it, and they will be an artificial disc put in here, and that will create that space. But generally speaking, the most common surgery is going to be microdiscectomy, these sorts of minimally invasive surgeries, and they are done, through keyhole, etc., to take away a bit of that disc. But it's not actually decompressing the spine, it's decompressing a small area of the spine. And if you're interested in those sorts of things, there's plenty of resources. We tend to take the more non-surgical approach, but you can definitely read more on the various surgeries if they're appropriate for you. And the final one is going to be non-surgical, clinical interventions, if we will. And that's using things like IDD therapy or spinal decompression in a clinical setting, involving strapping up the waist, strapping up the pelvis, strapping up the rib cage, using the machines to gently and in a targeted way decompress the relevant area of the lumbar spine. The same actually works for the neck as well when it comes to IDD therapy, but it's an option and something that we've used clinically over the years and are using again very shortly as we open the new space again. at the Back in Shape studio and start taking patients there. It's a great therapy. There's a reason we've used it more than once. It really does help. But again, not everyone has access to it. So if you don't have access to the ability to have these sorts of treatments, then you've got these at home. And I would argue if you're doing something like IDD therapy, you should be doing these at home anyway, because you want to regularly provide that relief to the discs. Because if you're having treatment once a week or once a month as a maintenance type thing, you want to still be doing that on a daily basis, because you're still compressing your spine on a daily basis. If you're doing your rehabilitative work, which you should be doing in conjunction with this, there's a little bit of compression there. Giving your spine a breather periodically through the day is important. You want to factor these sorts of things in, and when we can do them for free at home, why not do them? Because they do have a dramatic impact, and we know this from many members and patients over the years, doing things like the towel exercise or the bed decompression as part and parcel of their sort of back hygiene routine. It really makes a difference. People brush their teeth twice a day. You spend 2 minutes, maybe 3 minutes, twice a day, maybe 3 times a day. Why on earth would you not do the same for your spine? Because you can always get veneers. I always remember this. You can always get veneers, you can get fake teeth, you can get inserts, but it's much more difficult to replace your spine. So we should be devoting time to looking after this thing, because we only have one. And the great thing about it is it actually responds really well. And we know this because even people that have had surgery, had injections, and have objectively very bad diagnoses for their lower back can do remarkable things if they just devote the time, effort, and energy to doing practices like decompression and stretching at home to unload the spine, but also progressing to build back tolerance and resilience into their lower back. It makes a huge difference over the long term. It just takes a little bit of time. I think the final points here is, like I said, take care of your back. You only have one of them. Ideally, you'd be watching this and you don't have any back pain, but often that's not the case. Doing these sorts of stretches when you don't is a great way to keep these sorts of issues at bay and really decrease our risk of having any more severe cases of lower back pain. And coupled with the fact that now we know these sorts of things, you've watched this video, you understand those are not going to be ideal, you'll always gravitate to these if you have a minor case, which means a minor case doesn't turn into a major case. It really can help you being forewarned about these things. And that way we're using something like these decompression stretches as a preventative measure. Because even if you don't have objective back pain, well, if you don't have objective back pain, you probably haven't made it this far through the video. But even if you don't, you're going to benefit from doing these sorts of things. And you'll probably still find they feel nice, they feel relieving, even if you didn't realize you could be relieved, so to speak. So I think to round the episode today off, if you do have any questions, please always feel free to post them below. We read and reply and also to all of those, and maybe there's some questions as a result of this sort of stuff in today's episode. Please do post below. But remember, decompression is a relieving strategy. Right, it's helping you heal in the case of decompression therapy, or in the case of inversion table, all these stretches. We're helping get more nutrients into the discs, we're helping take pressure off them, but we have to be doing our rehabilitative strength-based work to add load and train those discs in a confined, controlled environment, train that back to be able to deal with more load over time and effectively move from a position of vulnerability and injury into a position of strength and resilience. That process takes time, but it starts with the first step. So just get moving and make sure that this is part of a full and robust rehabilitative approach. So thanks if you made it this far through the video. Remember, we've always got 3 ways we can help you. Number 1, we've got podcast episodes like these in the YouTube channel. Number 2, we have the membership to the program, which is where we help you guys go through a more structured approach to rebuild your back from home, and support you in doing that with the weekly lives and the members group to guide you along the way. And then we've also got more recently the virtual consultations and the ability to come into the space here and visit us for in-person treatments as well. So thanks so much for joining us, and we hope you found this episode helpful, and see you in the next one.